London and Middlesex County. We're glad to have you along with us. A welcome this afternoon to those who are joining us from the media. And a reminder, if you do have questions, please do submit them using the question forum here on Microsoft Teams. Click on the text bubble with the question mark in it. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And again, don't wait until later in the briefing for those questions. Get those in early. There's a lot to talk about today, including the media release that was issued by the health unit just before 2 o'clock this afternoon. As always, we want to welcome our guests, actually our regular cast, we could say, here on our virtual media briefings. Mayor of London, Ed Holder, and also the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. And finally, a welcome to those who are tuning in on Rogers Television this afternoon, or the Rogers Facebook page and YouTube channel, as well as listeners on Global News Radio, 980 CFPL, and those who are watching on the CTV London website. Let's get to the opening remarks right away, and we'll start this afternoon with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. First, I want to commend Western University along with King's, Huron, and Brescia for showing strong leadership when it comes to public health and public safety. As many of you have heard, last night Western became the first university in all of Canada to demonstrate proof of vaccination for all students, staff, faculty, anyone who plans to be on campus this fall. It's absolutely the right move for public health and public safety, not only on campus, but off campus as well. And I'd like to say that Londoners appreciate this important decision. Another positive sign came from the federal government. I was encouraged to learn they're actively working on a secure proof vaccination passport for international travel. This information will include the person's COVID vax history, the date they got it, the type of jab they've received, and where in Canada they were vaccinated. But what's more, while the passport is being crafted with international travel in mind, the federal government has said it's happy to work with the provinces to use it as a domestic proof of vaccination tool as well. I said earlier this week I was in full support of a vaccine passport, and this is where we need support from our provincial government. I look forward to raising this issue with the Premier at my earliest opportunity, because since the onset of the pandemic, I've had thoughtful and productive conversations with the Premier on a wide variety of COVID-related topics, things like increased testing capacity for London, mask mandates, and greater quantities of vaccine for our region. The issue to me of vaccine passports is just as critical. And look, no one's forcing anyone to get a shot. If you don't want the shot, that's your choice. I guess that's your right. But you do not have enshrined the right to go to a restaurant or a movie theater or a hockey game, a concert, or get on an airplane. Not only that, and perhaps more importantly, other people have rights too. They have the right not to have themselves and their loved ones put at risk by having to share space with individuals who choose not to be vaccinated. You know, my Cape-bred mother used to tell me, Edwin, your right to swing your arms ends just where another person's face begins. And that's the same philosophy that applies to these vaccinations. If you don't want the shot, fine, I guess. But you don't have the freedom to put others at risk, including children or those with compromised immune systems, or those who cannot get the shot for legitimate medical reasons. As we've seen in other jurisdictions where a passport system has been implemented, vaccination rates inevitably are driven higher. And that's our best defense against the Delta variant and the fourth wave that is here now. The vast majority of the public is in favor of vaccination passports. Business groups across Ontario, including our own London Chamber of Commerce, are in favor. And so too are small businesses, and in fact, all businesses from all across our city. Bottom line, it's the right thing to do. The passport will drive vaccination rates higher, keep hospitalizations lower, and ensure businesses are allowed to remain open, because no one wants to return to step one. Those were never the good old days. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. And so, as Dan mentioned, we are announcing today that the vaccine will be provided at health unit clinics to anyone born 2009 or earlier. This is a significant change, but it's not a big change. It's not a big stretch. We now have data from other jurisdictions that have offered this approach, showing that it's safe and effective. We're confident that this is the right thing to do to prepare students and ensure that schools are as safe as possible as they open in September. I also want to challenge today every employer in this area to look at what has happened at Western and consider implementing the sort of policy that Western has. We know that mandatory vaccination makes a tremendous difference in terms of safety for our staff, for customers, anyone interacting in a facility. We know that this sort of policy is possible and in fact is being implemented as we speak at Western University and in many places outside of post-secondary across Ontario and across Canada. This is something that is entirely implementable at the employer level, although as the mayor has pointed out, vaccine passports would make this sort of policy much more implementable in terms of validating the vaccination records, the vaccination records of people involved. This is very likely to happen one way or another. We know the fall wave is coming. We know it's going to be big. In the places that are a bit ahead of us in the curve, US, UK, Israel, high vaccination rates, and yet they're seeing a wave as significant as any wave they've had so far, with lots of spread among young people, unfortunately, and starting to see deaths and hospitalizations as well. This is coming, there's no doubt. We're already at the beginning. We're going to see more as the fall comes. And what also is likely coming as well is mandates in one way or another around the vaccine. The sooner we can get those in place, the better. It will protect staff, customers, the broader community. It's more likely to keep our businesses open, keep our society functioning if we get that mandatory vaccination policies in place. Obviously, if that can be done at the provincial level, that would truly facilitate a comprehensive approach to covering mandatory vaccination and ensure that our population is as safe as possible. But if it can't be done at that level, we have the ability to do that locally at the business and organization level, and we should. I want to support the concept of appropriate exemptions for mandatory vaccination. We have to have exemptions on human rights protected grounds, such as medical or religious. Also really encourage employers in those situations where people have exemptions to put alternative strategies in place, whether it is 3 times weekly testing for COVID to ensure that even those who have exemptions to vaccination are still safe to work in the workplace and work with customers, and or mandatory masking policy, even if that's dropped at the provincial level. This is an issue of safety for customers, for staff. It is likely to very soon become industry best practice and standard of care across a range of settings. So let's be prepared, let's be ahead of the curve, let's get these sorts of policies in place. And I know there will be questions about the doses that are expiring today. We don't have a final count on how many that will be. We'll release that as soon as we can. Look forward to any other questions.
Well, thank you very much, Dr. Mackie, and thank you, Mayor Holder. We do have quite a few questions already in the queue. And again, a reminder for the media in attendance this afternoon, don't wait, don't hold back on those questions. Get them in the queue so we can ensure that they are asked and answered. Let's go to the first one. Dr. Mackie, this one is for you, and it's from Jane Sims at the London Free Press. I think we already know the beginning of the answer to this question, but we'll go through it. Dr. Mackie, what's your reaction to Western University's decision announced last night to mandate vaccinations on campus and twice-a-week testing for non-vaccinated students, faculty, and staff? Given that several other Ontario universities have made similar mandates, are you hoping other sectors will follow suit? And should boards of education be taking notice of this decision?
Western's decision to ensure that their staff and and their students are vaccinated or are being tested twice weekly for COVID is a landmark decision. It shows national and international leadership. Truly impressed with the process that Western went through. I know this was not a decision that they thought deeply about a number of related issues. This is real leadership. Very impressed, and it's exactly where we all need to be. Absolutely agree. Other sectors should be following suit, and I think you're right to point out the boards of education should be taking notice as well. My understanding of those two sectors is that the boards of education are more connected with provincial leadership and policy and would have somewhat less independence to make this sort of decision. So I'm not sure it can happen at a board by board level, but certainly we will be discussing this with the school boards, as with a number of other healthcare and other employers over the next few weeks.
Thank you very much, Dr. Mackie. Next question is also from Jane Sims, but Mayor Holder, this one is for you. Mayor Holder, you have made clear your support of vaccine passports, which the federal government is now promising. Are there any plans to make vaccinations mandatory on City of London properties, and primarily at City Hall?
Well, thanks, Jane. First, I want to acknowledge the federal government's determination to proceed with the vaccination passport. I think it needs to be said again, and I look forward to the province following suit, which I think ultimately is a very logical next step, and whatever develops in terms of powers through that. And I make reference to powers because to that very specific question, I asked our legal counsel to provide some clear information as to what we were able to do as a municipality. And I know that other municipalities across the province have asked this same question, and we all have received the same response, that municipalities have no constitutional status, meaning that we have no inherent powers. The powers we exercise are transferred to us by the province. I suppose what we do have is the power of persuasion. And in that regard, were it up to me, all Londoners would receive not just the vaccination passport, but frankly, be double vaccinated. I truly think it's the only way to beat the Delta variant. And variants beyond that will come through. Here's my fear, that if we don't deal with this, the stat that I find the most compelling, and we don't deal with this, is that this pandemic of the unvaccinated impacts the vaccinated so dramatically. It clogs up our health system for those who have all done the right thing. And as a result, we have to take care of, and of course we have to take care of those who are hospitalized with this life-threatening virus. I am extremely concerned that all workplaces are not vaccinated, and I'm encouraging all London companies and our own employees at City Hall to get the shot. I'm encouraged that the greatest majority of employees who work with City Hall have been double vaccinated. But I truly believe that's important for all of us to do that. Were it within my power to mandate it, I would do that in conjunction with council. It is not a power that we have through the province. And that's the same with every municipality across the province. But I appreciate the question, Jane. Thanks.
Thank you very much, Mr. Mayor. Let's go to the next question. Dr. Mackie, this one is for you. It's another question from Jane Sims. Dr. Mackie, the local caseload appears to be starting to jump. 15 new cases today is a part of that pattern. Is there a breakdown regarding who has tested positive, fully vaxxed, partially vaxxed, or non-vaxxed? And are we seeing any outbreak activity? Is this following the prediction that this is a fourth wave for the unvaccinated?
Yes, absolutely. Jane, thanks for the question. This is a fourth wave of the unvaccinated, big time. In our area, still under 10% of cases over the past 6 weeks are among people who are vaccinated. Vast majority of cases are in those who are vaccinated. In hospitalizations, and again, we report this on rolling data from the past 6 weeks. So I'm not talking about yesterday, but from the past 6 weeks, 7.7% of hospitalizations fully vaccinated. over 93% of people in hospital with COVID did not have a full vaccination series. When you look at deaths, we're still at 100% of deaths over the last 6 weeks among people who are not vaccinated at all. Even one dose is very protective against deaths. We also have provincial data, which is now being reported. And that provincial data is very similar. The vast majority, and I don't think we've shown this before, Dan, so just beg your indulgence to share my screen here.
For sure.
So the province is now reporting cases by vaccination status. So I'll just scroll to the blue chart here. This is vaccination status of cases. Of the roughly 500 and I believe it's 514 cases yesterday, 88 fully vaccinated. That means over 80% were not fully vaccinated. The ICU is an even clearer picture. In ICU, 2 people fully vaccinated in Ontario. Almost 96% of people in Ontario in ICUs were not fully vaccinated. Hospital picture, somewhat similar, 10 out of about, 61 who are fully vaccinated in the ICUs. So yet again, the vast majority of cases, ICU and hospital, are among people who are not fully vaccinated.
Thank you very much, Dr. Mackie. Let's go to another question from Jane Sims for you, a follow-up. Dr. Mackie, how many more young people born in 2009 will be added to the 12 to 17 age cohort now that vaccinations are open to all born that year and earlier?
Yeah, Jane, our birth cohort is around 4,500 people. We have some net immigration, so in each year, you've got about 5,000 people in that age group. So we're now talking about a minority of people because, we're in August, so there's only kind of 5 months of the year left. That means that the number that we're adding is in the range of about 2,000 additional people added to that cohort.
Very much, Dr. Mackie. Next question. I think it's the last one from Jane. Dr. Mackie, today is the day the thawed Moderna doses expire. Yes, and we mentioned about that. We'll have some answers for that a little bit later. And we will share that, of course, on these briefings as well. So thank you for the question, Jane. Next question, Sophia Rodriguez from CBC News, London. Dr. Mackie, as you mentioned, the 4th wave is coming, but with high vaccination rates, should we be as worried as we were during the other waves? Do you anticipate lockdown measures like we saw last time?
Thanks for the question, Sophia. Anyone who's not vaccinated should be as worried as they were during previous waves. Unfortunately, almost all of our children under age 12 are not vaccinated. And so I think parents need to really think about that and do what they can to protect their children. So it's a challenging time for children and for parents of those children, and it's so important for all the rest of us to get vaccinated in order to try and protect those who can't be vaccinated.
Thank you very much, Dr. Mackie. Next question is from Daryl Newcomb at CTV London. Dr. Mackie, has Middlesex-London experienced similar racial inequity in COVID cases and deaths as contained in the recent provincial report? If so, what is being done locally to address this inequity?
Thank you so much for the question, Daryl. And Dan, I'll beg your indulgence again to share my screen here. So this is a tremendous report called Tracking COVID-19 Through Race-Based Data, just released yesterday. And it was produced by the Wellesley Institute and Ontario Health. Huge credit to them. We're going to skip to page 15, which is really kind of the money slide here. The findings. What this report adds that we haven't been able to do at the local level is age standardization. So we know because the age distributions are different among different ethnic groups, largely related to fertility rates, but also immigration status and experience. Age standardization means you compare different groups as if they all had the same age. So you increase the representation in your sample of underrepresented age groups in order to be able to compare across different groups. And what you see when you age standardize, last spring, we reported data based on race here in Middlesex and London. And the difference between white and non-white populations was in the range of 30% in terms of COVID rates. When you age standardize that, and with this two subsequent waves, we're now, been through 3 waves where at the time it was only 1. You see a very different picture that shows how stark the differences are across those different racial groups. And what you have here in this picture is cases, hospitalizations, ICU admissions, and fatalities. And this bar chart makes it clear that the impact on the white population is a very small fraction of the impact on, for example, the Latino South Asian population among cases, hospitalizations, ICU, fatality. Interestingly, the East Asian population fared quite well as well in comparison, but again, even if you just look at those two relatively close groups, you're seeing 20% higher here, almost 80% higher here, more than 100% higher in ICU admissions among East Asian compared to white, and a significant increase in fatalities. I'm going to zoom in on fatalities. These patterns, again, are fairly similar across these 4 indicators. If you look at the impact of COVID-19 in terms of mortality in the different racial groups, you can see in the white group, you've got, this is standardized by age. It's also a population rate, about 2.5 per 100,000 people. White people in Ontario died due to COVID in the first 3 waves. In the Latino group, that is over 20. So nearly 10-fold higher mortality rate in Latino group compared to the white group. This really points to the structural inequities. You have certain racial groups that are overrepresented in service industry, underrepresented in white collar roles. That makes their risk tremendously different. You've got housing access being different across racial groups. You've got wealth. All of the things that we know are the fundamental determinants of health are playing out here, in addition to some issues of systemic racism in healthcare and other sectors, and which can impact people's access to services and also their general well-being because of the related stress. So this is a truly incredible report, incredibly helpful to understand the differential impact of COVID across those populations. I will note the Indigenous group is not reported in this report, and that's primarily around issues of data ownership and independence. The best practice in terms of reporting data on health issues in Indigenous population is really to give the voice to the Indigenous people and ownership control of the data so that they can lead the description of what is happening in their population. There have been many examples over time when that hasn't been done and data has been reported in a way that actually increases stigma or otherwise impacts negatively the Indigenous population. So that's why that is not mentioned here. The specific question here around what do we have locally, again, we have very limited local data compared to the report that's been done provincially, a really tremendous report. We do plan to analyze what we have and do as much of a similar analysis as we can and bring that to our Board of Health in the fall.
Thank you very much, Dr. Mackie. Next question is a follow-up from Daryl. In addition to the 30 to 34-year-old age group, are there other demographic commonalities or geographical commonalities among the local unvaccinated population?
Yeah, so I think Daryl is referencing our vaccination rates by population, which is available at healthunit.com. And you can see that the age groups just above and just below the 30 to 34 age group also have somewhat depressed vaccination rates. I've recently looked at the similar picture in other municipalities, and it really depends. You do see in some municipalities comparable size like Hamilton, Waterloo, the rates are somewhat depressed, somewhere in that 20 to 49 age area. It's slightly different in each jurisdiction, but across the province that is not the case. Other demographic commonalities, we know that neighborhood is an important factor and that all of the social determinants of health play into neighborhood issues. It's not necessarily a geographic issue. We know that, for example, East London, Old East Village has had relatively low vaccination uptake, relatively low, we're still a majority of the population, even though Agriplex is right there in that area. So there's something else at play. We know that the issues of housing, income, and racism in healthcare systems can all play a role in terms of the likelihood people have the time and energy and motivation to go down and get vaccinated.
Thank you very much, Dr. Mackie. And we are down to our final question, unless there's another one that comes in at the last second. This one is from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Mackie, we've heard from someone who said they were turned away for their second COVID-19 shot because the pharmacy did not have the brand in stock that was the same as this individual's first dose. They were advised not to mix and match doses due to concerns about being unable to travel. Have you heard anything regarding individual healthcare providers advising against mixing and matching doses?
Thanks for the question, Jacqueline. We have not heard that complaint directly at the health unit. I truly hope that is a unique case, because we know that healthcare providers in general are very much on board with the interchangeability of Pfizer, Moderna, and taking the first available vaccine for the second doses.
Thank you, Dr. Mackie. That does bring us to the end of our questions. Mayor Holder, Dr. Mackie, thank you so much for your time and for your insights, as always, during these virtual media briefings. And thank you for joining us as well. That'll do it for today. We'll be back with our next virtual media briefing next Monday. That ends up being the 16th of August, if you can believe that. Time is flying very quickly this summer. We hope you will join us then. And between now and next Tuesday, have a great rest of your Thursday afternoon. Have a great weekend. We look forward to seeing you next Monday. And so long for now.